Hi, I'm Dr. Scott Russo, Senior Medical Advisor to Nutrifuel Nutrition. Patients today are challenged by the effects of a poor diet, generalized societal stress, and overall poor lifestyle behaviors. Nutrifuel Nutrition has created a surgical supplement kit designed to buffer these negative factors and prepare an individual to recover from surgery, illness, or injury. It is a well-known fact that the stress of surgery causes local tissue damage as well as significant systemic inflammation. Many people coming to surgery are not physically prepared. They're not prepared to recover after such an injuring event. It is a well-known fact that 2 out of every 3 patients coming in for gastrointestinal surgery are malnourished at the time of surgery. We know that if somebody is malnourished, they have a 3 times greater risk of surgical complication. There is research to suggest that a malnourished patient has a 5 times greater likelihood of dying than somebody who is well-nourished. And data shows only 1 in 5 hospitals do nutritional screening prior to surgery. Despite this fact, 3 out of every 4 surgeons believe that some form of perioperative nutrition can reduce surgical complications. And it has been studied that $1 spent on nutritional optimization of hospitalized patients can save up to $52 in hospital costs. Keeping this in mind, only 1 out of every 5 patients will receive some form of preoperative nutritional intervention. This is the specific reason that Nutrifuel Nutrition created a surgical supplement kit, unlike anything currently available in the United States today. This kit is composed of 7 key nutritional supplements designed to impact specific body systems, potentially enhancing a patient's recovery from surgery, illness, or injury. The kit is designed to begin 3 weeks before surgery, where the patient takes a full 2 weeks of supplements, as well as eating an ideal Mediterranean diet. Most hospital systems request that a patient hold all nutritional supplementation for a 5 to 7 day period prior to a surgical operation. Our supplements are designed to begin immediately upon discharge from the hospital and will continue for the next 2 weeks, giving a patient a full 4 weeks of nutritional optimization. In addition, our emulsified vitamin D will provide additional supplementation for several weeks after the completion of the kit. After a patient finishes a surgical kit, we recommend that they continue with the Nutrifuel Nutrition General Wellness Kit for continued health and wellness. The first supplement is our multivitamin, multimineral, and phytonutrient. A multivitamin is a supplement that contains more than 1 vitamin, but in reality, they often contain multiple vitamins, essential minerals, and often key phytonutrients. Nutrifuel's OsteoHealth Complete is composed of 13 vitamins and 15 minerals, as well as strategic phytonutrients like citrus bioflavonoids, as well as amino acids lysine and methionine, critical for calcium absorption, collagen formation, as well as the development of connective tissues within the body. Coenzyme Q is critical for cellular energy management and mitochondrial health, and is known to improve heart health. As a surgical prep and recovery supplement, this supplement contains copper and iron for postoperative blood recovery. Wound healing is a critical piece of the postoperative experience. This is where our multivite provides ample amounts of vitamins A, C, E, and the minerals zinc, selenium, and iron. The second key supplement is our Amino Complete. It is well known that the stress of surgery causes proteins to be broken down and hyperglycemia to occur, putting pre-diabetic and diabetic patients at higher risk of complications. Amino Complete is a concentrated form of amino acids obtained from whey protein hydrolysate. It is well known that the optimal nutrition is a key factor in maintaining all phases of wound healing. This protein supplement is rapidly absorbed from the gastrointestinal tract. It improves digestion and amino acid availability. It also protects the body from breaking down key proteins needed for other important processes like blood clotting, muscle function, as well as immune and cardiovascular health. We recommend that patients continue to exercise as they prepare for surgery, preventing sarcopenia or the loss of skeletal muscle and function, especially prevalent in seniors. Also, it potentially lessens the likelihood of falling after surgery. We recommend that a patient get at least 1.2 grams per kilogram of body weight per day of protein. So in addition to the Amino Complete, dietary sources of protein like fish, poultry, and beef are encouraged. The third key supplement is our essential fatty acid blend, or EFA Restore. It is a combination of fish oil, flaxseed oil, and borage oil, and provides a balance of omega-3, 6, and 9s. These fatty acids are critical building blocks for the structural components of cells, tissues, and organs. Several of these fatty acids are not able to be manufactured within the body and are considered essential and are only able to be obtained through the diet. Omega-6 fatty acids are important in the early aspects of wound healing, while omega-3 fatty acids act later in the process by producing critical biologically active substances that do lessen inflammation and potentially improve blood flow to the healing tissues. Additional clinical effects of essential fatty acids can be as anticoagulants, antihypertensive, impacting the lipid metabolism while supporting the functioning of a very healthy nervous system. They are important mediators of inflammation and can also impact the negative effects of cancers by helping patients maintain their lean muscle mass. Immune support is the fourth supplement in the kit. It is a complex oligopolysaccharide, arabinogalactan. It's made from the larch tree. It passes through the upper gastrointestinal tract into the colon, where it feeds the patient's natural gut bacteria. The resident bacteria, or our critical microbiome, are fed by the fiber through the process of fermentation, and in effect produces short-chain fatty acids. These fatty acids, or butyrate, can improve the immune system by feeding our gut lining cells and maintaining the integrity of the epithelial barrier. There are potential benefits of enhanced natural killer cell cytotoxicity, whose inactivity has been associated with the chronic diseases of cancer, chronic fatigue, and various autoimmune disorders. Additional benefits are the lessening of constipation and regulation of bowel movements. Nutrifuel's Probiotic Plus, the fifth supplement, is a symbiotic, or the combination of prebiotics and probiotics. The probiotics are live microorganisms whose purpose is to improve the health and wellness of the host. There are three prebiotics: inulin from chicory root, arabinogalactan from the larch tree, and marshmallow root. The probiotic component contains up to 20 billion organisms at the time of production. There are 7 probiotics, 3 bifidobacterium, 3 lactobacilli, and 1 streptococcus thermophilus. With illness, injury, and the stress of surgery, a patient's gastrointestinal tract can become damaged and cease to function normally, leading to overgrowth of unhealthy bacteria and diarrhea. The use of broad-spectrum antibiotics can impact up to 30% of a patient's normal gut flora and may take up to months or even years to recover. The use of the probiotic or the prebiotic combination can strengthen the immune system through the gut-associated lymphoid tissue, lessening the risk of postoperative complications like infection. We can also see improved functioning of the gastrointestinal tract and the way in which food is digested and nutrients are absorbed. The sixth supplement is our digestive support, a combination of digestive enzymes and acids designed to impact the body's ability to digest and absorb proteins and B vitamins. Acid and enzyme secretion often decreases as people age, and in some situations may result in bacterial overgrowth in the stomach and possibly the small intestine. We know that low or absent stomach acid can significantly impact calcium absorption and raise the risk of osteoporosis. This is not uncommon in patients that have undergone removal of part of their stomach or have had gastric bypass surgery. This supplement is contraindicated in individuals with an active ulcer or in doses outside of the recommended amount, as well as in patients with a prior current allergic reaction. And our final supplement, and the foundation of the surgical supplement kit, is our vitamin D3 Restore. The uniqueness of our supplement is its emulsified nature, resulting in enhanced absorption. Vitamin D3 is a steroid hormone classically known to affect calcium and phosphate metabolism while supporting bone health and lessening the risk of osteopenia and osteoporosis. It is now known that a high percentage of the world's population is either vitamin D insufficient or deficient. The physiologic benefits of vitamin D go well past its impact on bone health. Current research is exploring the benefits of vitamin D on our immune system, the prevention and treatment of cancers and viral respiratory infections, and most importantly, its impact on chronic inflammation. Especially pertinent to orthopedics in general and spine surgery in particular is the common finding of insufficiency or deficiency in the pre-surgical evaluation of these patients. So pre-surgical optimization of a person's vitamin D level is critical. The Nutrifuel Nutrition Surgical Supplement Kit is the most thorough pre- and post-surgical supplement kit on the market. Thank you.